Well, good afternoon, everyone. It's great to be here in Victoria, joining my colleagues from across the country at this Premier's meeting, the Council of the Federation. I wanted to announce something that Alberta is doing to further our national leadership in getting to free trade, to cut costs for Canadians, help them deal with the crisis in inflation and cost of living, while also creating jobs and more economic prosperity. There have been dozens of reports by think tanks and scholars on the huge cost of the lack of free trade within the Canadian Federation. Estimates range from between $40 and $100 billion in annual economic opportunity lost, costs that are imposed on consumers and employers because of the intergovernmental rules, barriers to the free trade in goods, services, and mobility of labor. One big part of that is the huge, burdensome patchwork of regulations across the Canadian economy that is making us less competitive, less productive, and less prosperous. The number one issue in Canada right now is the cost of living, inflation. A big part of that is energy inflation, and that's why here at this meeting and every day, Alberta's government is pushing for a common sense energy policy that allows Canada, with the third largest oil and gas reserves, to produce more, to ship more, to create more supply, to reduce prices. That's one of the things we've been focusing on here. But as I say, we have been exercising also great leadership on the issue of internal trade. That's why at this meeting in 2019 at Saskatoon, I announced that Alberta was leading with bold action by unilaterally dropping 85% of our exceptions under the Canada Free Trade Agreement. That's the agreement that provinces came to 5 years ago to, in principle, have free trade. But there are still over 300 exceptions filed under that. Only 6 of those are filed by Alberta. We also took an important step forward on labor mobility. The costliest part of internal trade barriers is all of the red tape that Canadians have to go through if they move from one province to another as skilled professionals. That too is holding back our economy, and it's why Alberta's legislature passed the Labour Mobility Act last year, which automatically certifies the credentials of Canadian professionals from other provinces, giving the regulators just 20 days to certify that they are qualified to work in our province. And I have today renewed my call on other provinces to follow Alberta's lead, drop their exceptions under the Free Trade Agreement, adopt a law like the Labour Mobility Act. And we've taken another step forward. I want to point today, which is to an important step forward on streamlining regulations across the country. Last month, the Canadian Federation of Independent Business published their State of Internal Trade, Canada's Interprovincial Cooperation Report Card, and I'm pleased to report that Alberta got the highest grade in the Federation. But unfortunately, the average grade across the country, I think, was a D, showing how much more work there is to do. That is why Alberta is leading the way with a concept that we are borrowing from Australia and New Zealand. The Council of the Federation has been working now for years at a snail's pace at something called regulatory harmonization. That's working through all the different areas of regulation, trying to come up with common standards. Well, at this pace, it's going to take us another couple of hundred years before we get to where the European Union is at in terms of regulatory harmonization. There's a much faster, simpler, more efficient way of getting past the problem of complex regulations that cause companies and workers, businesses and professionals to operate under multiple different regulations across the country. And that would be mutual recognition. As I say, Australia and New Zealand have done this for years, where basically Australia says, New Zealand will accept how you regulate goods, services, professionals, and New Zealand does the same. And so we have launched a study with the Macdonald-Laurier Institute. We are expecting the results back in September to call on to develop a model for recognizing credentials from other and regulations from other provinces. This would be a revolutionary step forward if we can get this done. It's an idea I've just presented to my colleagues here amongst the premiers, and I think it was very well received. I think you'll see that reflected in the communique that's released later this afternoon. So I'm here partly just to renew Alberta's call on all provinces and territories to stop the pointless protectionism that's costing our economy tens of billions of dollars, help consumers deal with inflation, get costs down, get jobs up by embracing internal trade. Let's make Canada the economic union that the founders of Confederation originally envisioned. And with that, I'm happy to take questions.
Thank you, Premier. We'll go to the floor here first. One question, one follow. Name and outlet, please. Thank you.
Global News on behalf of my friend Tom Vernon, and he speaks to the fact that you have argued for a long time about internal trade barriers. What progress do you actually believe is happening in this country right now? What can you point to in terms of things becoming freer, in terms of what other provinces are doing for trade?
Well, some progress would be the Canada Free Trade Agreement itself that was adopted 5 years ago. Before that, we had something called the Agreement on Internal Trade. It was a pretty low-quality agreement, didn't help us a whole lot, but the Canada Free Trade Agreement that was adopted by this group, the Council of the Federation, 5 years ago, was an important step forward. Unfortunately, provinces filed, and the feds filed, a whole bunch of exceptions, making it kind of like a Swiss cheese agreement, filled with holes. There was over 300 exceptions. And I think all it takes is political will. That's what we did in Alberta. We didn't wait around horse trading and negotiating and analysis paralysis and endless consultation and all the excuses for inaction. We just, to borrow a phrase from Nike, we just did it. We just said this is too important for the country, and we believe that we benefit even from unilaterally dropping restrictions on trade and procurement and all of that. So I think there's been progress. That's what the CFIB says. Some pretty good progress, but a heck of a lot way further to go. Another area where I would see progress lately would be labor mobility. We brought in our Labor Mobility Act last year that, again, basically tells our professional regulators they got to get with the program. If a dentist from BC moves to Alberta, if a psychologist from Nova Scotia comes to Edmonton, we're telling the regulators they have to certify that they can work in Alberta, recognizing their BC or Nova Scotia credentials, and they only have 3 weeks to get it done. Since we did that, 2 other provinces, Saskatchewan and Manitoba, have followed suit with similar legislation, and I think a few others are looking at it. So it's useful to have a province like ours that's willing to take, I don't know, some calculated risks on this, and hopefully other provinces will follow suit.
You've been pretty clear on the carbon tax. Did you get any sense there was any consensus in the room of premiers in terms of the direction Ottawa needs to go on the carbon tax?
No, I would point out, however, that 6 provinces, including Alberta, went to the Supreme Court of Canada 2 years ago on our judicial reference, our constitutional challenge of the federal carbon tax. So you have a majority of provinces that backed Alberta in opposing the carbon tax. It's one of the biggest government levers that's driving up the cost of living. I can't understand why the Trudeau government on April the 1st increased the carbon tax by 25% when people are facing energy poverty and they're getting whacked with inflation. So in Alberta, this is why we're opposed to the carbon tax. We believe in climate action. We have had a levy, a cost for major industrial emitters of greenhouse gases for 15 years before any other jurisdiction in North America. But we don't believe in punishing seniors and stay-at-home moms for heating their homes and turning on the lights and driving to work. So we have a fundamental disagreement with the feds. I think most provinces are on our side on that, but not all. It's clear that that British Columbia has a different view about retail carbon taxes. We respect their right, but there is no unanimity amongst the provinces on that.
Janice McGregor, CBC News. The Canada Free Trade Agreement is already a negative list deal. So I'm reading about what you're saying about this approach from Australia and New Zealand. I don't really understand the difference between what you're proposing here and the way the previous agreement was already instructed. And just if I may, isn't having another study on this an example of the analysis paralysis you're talking about? Isn't the real story here that a liberalizing province like your own has failed to convince your colleagues to follow suit?
A fair question. So I just need to make a basic distinction. The Canada Free Trade Agreement And the negative list, where people can file exceptions, is about trade. It's about trade in goods primarily and rules around procurement. Separate and apart from that is the regulatory cooperation table. And basically, the premiers told that table 5 years ago, you go away and work on harmonizing regs across the country so we can hopefully get to more common standards that's a lot more efficient. Unfortunately, in 5 years, they've only come to an agreement on 11 areas. This is not about trade per se. It's not about procurement. It's about provincial regulations, a different area, different but related. And so we've only come to agreement on 11 of thousands of areas. And what we're saying in Alberta is, look, at this pace, none of us will be alive if we ever get to something close to full harmonization on rules, on regulations across Canada, the way that Europe has. Europe's done this. It took them 40 years, hard work, but they got it done in the EU. So we're looking for a different model. Instead of taking decades and decades of endless bureaucratic churn, how can we get major results that create growth, cut costs for the Canadian economy right away? And I think the Aussie, New Zealand model is the right one. It's never really been studied seriously as a viable model. That's why we're launching this review by the Macdonald-Laurier Institute. We're asking them to do it very quickly so we can get results back in a couple of months. But when you see the communique from COF this afternoon, you will also see premiers directing the regulatory cooperation table to speed up its analysis of a mutual recognition model. And let me add one other thing. Depending on what Macdonald-Laurier tells us, and I'm a terrible negotiator on this stuff, because I just believe, I'm so passionate about Canada's economic union. I am prepared to go cold turkey, to go unilateral in principle, to recognize other provinces' regulations, even if they don't agree to go into an accord with us. That's what we did in eliminating 85% of our exceptions to the CFTA. That's what we did in speeding up recognition of credentials from other provinces. We didn't wait to haggle. We think the benefits are so strong that I am prepared in principle to do this unilaterally in the time that I have left to me.
Just on the recognition of credentials, I want to relate this to the healthcare staffing crisis in this country, because there is a connection. And I'm wondering how other premiers around the table feel about the proposal to recognize, for example, the credentials of other healthcare workers, because we heard Premier Horgan, for example, say, no, we pay to train these people. We can't afford to have them poached by other jurisdictions. And isn't that really the fear?
Sure. That
you could have provinces bleeding their essential healthcare workers to other jurisdictions for whatever reason if you put this in place?
Yeah, there's always been that concern, that anxiety. And I'll admit, Alberta has been a challenge for other provinces because through most of our history, we've offered higher wages, salaries, and benefits to doctors and nurses, and we have often been a bit of a magnet for workers from other parts of the country, also probably causing inflation in healthcare costs. That's less so the case now. We've managed to get our costs down. We've went through some very challenging collective bargaining with nurses and other public sector unions. So we're now much closer to the national average. So we're less of an outlier. So I think all provinces are anxious about that. At the same time, you will see in the COF communique today, language committing all provinces to streamlining labor mobility, recognition of credentials specifically and especially in the area of healthcare. I think all provinces realize that a rising tide lifts all boats, that we'll all be better off if there's greater labor mobility in the country, and that patients at the end of the day are not going to be better off if we create 10 silos in terms of healthcare labor markets in the country. So I think the premiers, they all want to take care of their citizens, but at the same time understand that we would all benefit from a more streamlined movement within the country.
Hi, Véronique Prince, Radio-Canada. Would you be comfortable enough to answer in French?
Certainement. Pour une petite sommaire pour dire que l'économie canadienne perd dizaines de milliards de dollars chaque année à cause de manque de libre-échange à l'intérieur du Canada. Il y a beaucoup plus de libre-échange dans les 28 pays de l'Europe que les 10 provinces du Canada. C'est la raison pour laquelle l'Alberta a pris le leadership fort à cet égard. Et aujourd'hui, j'ai lancé un appel aux autres premiers ministres d'éliminer la plupart de leurs exceptions sur l'entente de libre-échange du Canada et d'accélérer la reconnaissance des titres professionnels. Et troisièmement, nous lançons une étude sur le potentiel de reconnaissance des réglementations des autres provinces, comme ils font entre l'Australie et la Nouvelle-Zélande. Alors, je crois que ça serait un modèle pour accélérer les libres-échanges à l'intérieur du Canada pour créer les emplois, réduire les coûts pour les consommateurs et les entreprises. Et moi, je crois que c'est bon temps pour le Canada d'être une union économique, mais ça prend de l'action au part des provinces et je crois que c'est un bon début.
Et sur les transferts en santé, avez-vous entendu Dominique Leblanc qui dit que les provinces ne doivent pas diminuer leurs dépenses et leurs investissements en santé si Ottawa donne l'argent?
Ouais, non, je n'ai pas entendu l'entrevue, mais c'est clair que tous les premiers ministres des provinces sont réunis sur le principe que le fédéral doit payer les fonds nécessaires et justes pour s'adresser aux crises dans le système de santé publique au Canada. Et ce n'est pas suffisant pour l'Ottawa à lancer les insultes envers les provinces. Nous sommes responsables pour livrer les services de santé. Et la pandémie a souligné un manque de capacité dans toutes les provinces. Et nous faisons, toutes les provinces ont augmenté leur budget. En Alberta, on a augmenté le budget pour la santé par 2 milliards de dollars dans les les dernières 3 années. Alors, on a fait les investissements sans parer. Mais le gouvernement fédéral ne fait pas son part. Et j'espère que... Pourquoi est-ce que M. Leblanc s'impliquait à cet égard? C'est une question pour le Premier ministre, le ministre des Finances. Si la santé publique est vraiment une priorité pour le gouvernement fédéral, il faut le montrer avec un engagement pour augmenter les transferts de santé au Canada.
In English, Prime Minister?
Translation, that's the same thing. So I was just saying, look, I didn't see Mr. LeBlanc's interview. Not even quite sure why he's involved in this, because it's a fiscal issue. It comes back to the finance minister and really the prime minister. Is healthcare a priority for the federal government or not? Provinces are spending record amounts. We've added $2 billion to our health budget in Alberta, and it's not enough. We can't keep up. Our healthcare workers, our doctors and nurses are being run off their feet. We saw all across Canada a huge challenge with capacity during the pandemic, and it's not getting any better. And the federal share overall has declined. You've got a consensus between from the NDP in BC to Alberta Conservatives and everybody in between, east to west. And the real question, is this a priority for the federal government? So far, it appears not to be.
Bonjour, M. Kenney. Michel Sabat, La Presse canadienne. Je veux poursuivre sur le sujet. M. Leblanc, ministre des Affaires intergouvernementales, a dit « Bien sûr, il y en aurait des conditions. » Vous, au Conseil de la Fédération, vous dites « On n'en veut pas de conditions. » On fait quoi à partir de là? On en parle pour 3 ans encore?
Oui, bien, clairement, c'est frustrant, mais les provinces, nous étions très patients envers le fédéral. Le premier ministre Trudeau nous a dit à plusieurs reprises, attendez-vous à la suite de la pandémie, nous allons avoir les pourparlers et un sommet des premiers ministres pour discuter la santé. Mais ben, rien ne s'est passé. Il n'y a aucune action. Je crois qu'ils ont pris une décision dans leur budget dernier de laisser la santé aux provinces. Et ils ont décidé de dépenser milliards de dollars sur les choses dans le champ des compétences des provinces. comme les pharmaceutiques et les soins dentaires. Mais on a besoin, franchement, d'un élargissement large pour tous les services de santé, par les petits programmes ciblés par le fédéral. Alors, les provinces, nous étions très diplomatiques, je dirais, mais c'est notre responsabilité envers nos concitoyens à livrer ces services-là, et nous sommes en train presque à une crise dans le système de santé au Canada.
L'Alberta serait-elle prête à offrir de ne pas réduire ses dépenses en santé ou de couper ses impôts ou de donner des chèques de 500 $ pour avoir du financement fédéral? Est-ce qu'elle serait prête à offrir cette garantie-là?
Oui, nous, absolument, nous engageons de ne pas réduire nos dépenses sur la santé. Mais si ça, c'est une condition du fédéral, il faut présenter la condition dans le contexte des négociations, des pourparlers, et par un débat dans les médias. Ce n'est pas fructueux, ça. Les Canadiens, ils ne veulent pas une chicane politique, puis ils veulent le progrès. Au moins, venir s'asseoir avec les premiers ministres, discuter cette question, cette idée. Moi, je suis très heureux de donner un engagement de ne pas couper les dépenses pour la santé. Au contraire, on a augmenté par 2 milliards de dollars et ça probablement va continuer.
Bonjour, Nicolas Lachange, Journal de Québec, Journal de Montréal. Dans le dossier du libre-échange, quelle a été la réaction de M. Legault et du Québec à cette demande?
Je crois que ce n'est pas approprié pour moi de révéler les commentaires des premiers ministres particuliers. Vous pouvez poser cette question à M. Legault, mais je crois que le Québec fait partie de l'entente sur le libre-échange du Canada. M. Legault est axé sur la croissance économique du Canada et du Québec, et je crois qu'il comprend, comme un ancien homme d'affaires, que tout le monde profite de plus d'échanges, plus de mobilité, moins de réglementation. Alors, je crois qu'il y a un consensus, en principe, parmi les provinces, mais c'est une question de l'action. Et nous autres, en Alberta, on est toujours en mesure de prendre l'action ambitieuse pour accélérer le libre-échange domestique.
Hi, Premier. David Cochran with CBC. I know you say you didn't see Minister LeBlanc's interview, but I wonder if you have a specific rebuttal to the point he made that there are premiers here who are discounting the significant federal support throughout the pandemic and are now either running surpluses or giving rebates back to voters and constituents, while at the same time saying they don't have enough money. Do you have a specific rebuttal to that point?
Well, we're all trying to help Canadians deal with the current crisis in inflation and the cost of living, highest inflation in 40 years. And so it stands to reason that provinces are trying to do a bit to help out with that. In Alberta's case, we've suspended collecting the provincial fuel tax. But these are one-time measures to address a particular crisis, an economic crisis, people having to choose between groceries and their heating bills. On the Canada Health Transfer, we're talking about a long-term, multi-year recurring funding agreement for a critical public service. And so I think it's cheap and disingenuous if the feds are saying that we can't both provide decent health care and give people a bit of relief during 40-year high inflation. Look, we're all responsible to the same Canadian voters. And I think their top two priorities right now are inflation and health care. That's the case for the provinces. Are those the top two priorities of the federal government? I don't know.
So given this impasse in the conversation, where there's even a basic disagreement over what the funding split is for healthcare right now, and the resistance at the provincial level to accept the conditions that they're insisting on at the federal level, how do you bridge this? I mean, how do you find a common ground?
How is we sit down and talk, and that's really what we've been asking for, nothing more. We're asking for to going from 22 to 35% cash transfers for the cost of health care in Canada. But the immediate thing we're asking for is to sit down and talk about it. You just said that there are federal conditions. I don't know what they are. I've never received a letter from the Prime Minister or the Minister of Finance or Minister LeBlanc or anybody about that. My colleagues haven't. John Horgan has been leading these preliminary efforts at a discussion with Ottawa, and he can't even get a meeting date. So, you know, if they've got something to say to us about conditions, come and sit down and say it. But so far, it just looks like they're ragging the puck because they have no intention of paying their share. Okay, thanks very much.
Well
I got to
done.
get
Thank you,
back to
folks.
it.